Hello everyone, and welcome. Today, we're going to dive into a topic that touches so many of our lives, but is often surrounded by silence and misunderstanding, and that's our mental health. So let's get right into it, and hopefully shed some light on a few common psychological disorders and the pathways to healing.
Okay, before we go any further, let's get one thing crystal clear. Dealing with a mental health condition has absolutely nothing to do with being weak or flawed. These are medical conditions, They're rooted in our brain chemistry and how we process the world. Just like you'd treat a physical illness, these conditions deserve understanding, care, and of course, effective treatment.
So first, let's talk about depression. And it is so important to understand that this is not just about feeling sad for a day or two. It's this persistent, heavy feeling that can completely drain you of energy and emotion, almost like the color has been washed out of your world.
When we talk about the core symptoms, it's this trio that really defines the experience. First, there's that persistent sadness, this heavy cloud that just doesn't seem to lift. And that often leads to a profound loss of interest in things that you used to love. And all of this is wrapped in this overwhelming exhaustion and a feeling of hopelessness, making even the smallest steps forward feel like climbing a mountain.
And this right here really captures the invisible nature of the struggle. I mean, think about it. On the outside, this person's life might look totally fine to their friends and colleagues, but inside they're fighting this immense battle just to get through each day. It's this deep internal exhaustion, this feeling of being a ghost in your own life.
So what does help look like? Well, it's usually a combination of things working together. A really powerful tool is cognitive behavioral therapy, or CBT, which helps you learn to recognize and challenge those negative thought patterns. That's often supported by medication, which can help rebalance brain chemistry. And you can never underestimate the power of lifestyle changes and having a strong support system around you.
Okay, let's shift gears and talk about anxiety disorders. Now, we all get stressed, we all worry, but this is on a whole different level. It's like your brain's internal alarm system gets stuck in the on position. It's constantly screaming, danger, even when there's no real threat.
And the experience of anxiety is so physical. It isn't just a mental state of excessive worry. It's this constant, restless feeling, like you're on edge and just can't relax. And that feeling creates very real physical symptoms. Your heart races, you feel short of breath, maybe you get dizzy, and that can be incredibly frightening all on its own. This is such a relatable example, isn't it? The normal stress of an exam gets dialed up to 11, becoming this paralyzing fear. Your mind is just racing with worst-case scenarios, you can't sleep, and your body is reacting as if it's in mortal danger. It can completely take over and make it impossible to function.
But the really good news here is that there are incredibly effective tools. Exposure therapy, for example, is a way to gently and safely face your fears in a controlled setting. It basically retrains your brain to understand that it can handle the situation. When you combine that with CBT and really practical tools, like deep breathing, you can learn to calm your own nervous system and take back control.
Now, let's talk about Obsessive Compulsive Disorder, or OCD. There's this huge misconception that it's just about being super tidy or having a few quirky habits. But in reality, it's a deeply distressing cycle that's fueled by unwanted, intrusive thoughts that create unbearable anxiety.
And that cycle works like this. It all starts with an intrusive thought, which we call an obsession. This thought feels so real and so terrifying. To get rid of that awful anxiety, the person feels this overwhelming need to perform a repetitive behavior or a compulsion. Doing that ritual brings a tiny moment of relief, but it's only temporary, and then the cycle starts all over again. Can you just imagine how incredibly frustrating that would be? Logically, that the door is locked. You just checked it. But your mind is screaming at you, creating this huge wave of doubt and anxiety that only goes away if you check it again and again and again. It's an exhausting loop that can literally take over a person's life.
So the gold standard treatment for OCD is a specific therapy called ERP, and it's all about breaking that cycle. A therapist helps the person face that obsessive thought without doing the compulsive ritual. Now, it's really hard work, but it teaches the brain that the anxiety will eventually pass on its own, and that robs the obsession of its power.
Next, we're going to talk about schizophrenia, and it's so important that we approach this with care and compassion. This is a serious mental illness that really changes how a person thinks, feels, and sees the world, which can create a profound disconnect from the reality that most of us share.
The illness is really characterized by a few core symptoms. First, there are hallucinations, which means sensing things that aren't there, and the most common is hearing voices.
Second are delusions, which are very strong false beliefs that don't change even when someone is shown proof that they aren't true. And finally, disorganized thinking can make it really hard to form clear thoughts or carry on a conversation.
And it's so crucial to understand this. For the person experiencing them, these voices are 100% real. They aren't just thoughts. They're heard as if they're coming from outside, and they can be critical or commanding or even just conversational. And of course, they can have a huge impact on a person's feelings and actions, making their world a really confusing and often scary place.
Managing schizophrenia really requires a team effort and long-term care. Antipsychotic medication is often a key piece of the puzzle to help reduce symptoms like hallucinations. But just as important are psychosocial therapies that help with life skills and social interaction, and of course, a strong, informed support system from family and the community.
And that brings us to what I think is the most important part of our conversation today. After hearing about the challenges that these conditions present, I know it can feel a little heavy, but I want to be really clear. A diagnosis is not the end of a happy, meaningful life.
सवाल है जिस पर हम सबको सोचना चाहिए।
मनोविज्ञान के बारे में अधिक जानने के लिए हमारे चैनल को सब्सक्राइब करें।